Presenting a case of prenatally diagnosed orbital tumor treated successfully in a neonate by transconjunctival approach, minimally invasive orbitotomy. To the best of our knowledge, no such reports exist in the Indian literature, and only a handful of reports exist worldwide. The child was diagnosed to have left orbital tumor on a routine prenatal ultrasound and was kept on close follow-up and was delivered by elective cesarean section in the 38th week of pregnancy. Examination of the neonate showed left proptosis, lag of thalamus, and a tense orbit. Despite the risks of general anesthesia, the child was taken up for surgery in view of the significant risk of irreversible visual loss secondary to compressive optic neuropathy. The surgery was challenging both from the anesthesia point of view as also due to the tiny size and delicate architecture of the neonatal orbit and all its structures. A lateral canthotomy and cantholysis of the inferior and superior limbs of the lateral canthal tendon were performed. The thinnest malleable orbital retractors were gently placed for retraction of orbital tissues. The pupil was monitored throughout surgery and retraction was eased every few minutes to avoid any risk to the optic nerve. Slow and meticulous retraction was performed and no sharp dissection was performed. Slowly, the tense cyst came into view and gentle dissection was attempted around it. The cyst was densely adherent to surrounding structures, the optic nerve and the orbital apex. Decompression of the tense cyst was performed and a brown fluid aspirated. The cyst collapsed and a rectangular window as large as safely possible was removed from the wall of the cyst. This was done with a view to prevent reformation of the cyst. The tissue was sent for histopathology. Good hemostasis was maintained throughout, and finally the tissues including the conjunctiva were gently repositioned back. The lateral canthus was reformed by reattaching both the limbs of the lateral canthal tendon back to the bony periosteum, and the skin was closed. The conjunctival wound was left unsutured as a self-draining portal for egress of blood in case of any post-operative bleeding. The eye was left unpatched. Histopathology revealed, much to the relief of all concerned, findings consistent with the diagnosis of congenital simple epithelial cyst with respiratory epithelium. A year later, the child remains free of any symptoms, with good vision in the eye, full ocular movements and a barely visible scar. The case interestingly received considerable media attention due to its rarity and the gratifying results we obtained.